Good afternoon, Vancouver. I'm Mayor Ann McEnerny-Ogle, and today is Wednesday, October 13th. As we move into the fall season, our lives continue to be largely impacted by COVID-19 and the precautions and protocols necessary to battle the spread of the virus. Many of you are following the guidance, wearing face coverings, practicing physical distancing, and getting vaccinated. And I thank you for doing that for yourself, for your family, and for our community. Updated numbers show it's making a difference. Cases have decreased recently in Clark County, but are still very high. The numbers of recently hospitalized COVID patients and deaths in the area have also fallen, but we still have a long way to go. Earlier this month, the daily average of reported cases by day in Clark County was 156, a 15% decrease from the average 2 weeks earlier. Still, our local hospitals and the entire community continue to be strained by the pandemic, with COVID-19 levels much higher than they were during the spring and much of the summer. September was the month with the most cases reported ever in Clark County, peaking at 549 per 100,000 residents. July had the lowest reported rate of 50 cases per 100,000 residents. Since the beginning of the pandemic, at least 1 in 13 residents have been infected, with a total of just over 38,000 reported cases. Right now, Clark County remains in the very high risk category for those who are unvaccinated. This chart graphic shows the difference in case rates by vaccination status, with fully and partially vaccinated people remaining relatively low compared to those who are unvaccinated, depicted by the gray line. Remember, simply ignoring the pandemic won't make it go away, but as a community, our collective actions can help ensure that infection rates this fall and winter continue to go down. Although there is a lot we can't control about the COVID-19 pandemic, we can control our own behavior and try to do everything we can to help slow its progress. There is one proven tool we have at our disposal to fight it. And as I've said before, it bears repeating. Vaccines are the most reliable way to slow down and prevent the deadly consequences of COVID-19. Encouraged by the growing number of those getting vaccinated in Washington. As of October 4th, just over 77% of Washingtonians 12 and older had received at least one dose of COVID-19 vaccine. And close to 71% of people 12 and older are fully vaccinated. Those numbers are slightly lower in Clark County, where just over 68% of all residents have at least one dose, and 62% have been fully vaccinated. If you're ready to roll up your sleeve and get the shot, you can find Pfizer and other vaccines quickly and easily through walk-ups or appointments at pharmacies and doctors' offices all over Vancouver. The Washington State Department of Health has recently also started offering booster doses of the Pfizer vaccine to certain people following recommendations from the CDC and other groups. At least 6 months after completing the primary Pfizer vaccine series, people 65 and older should receive a booster dose of the Pfizer vaccine. Others eligible for booster shots include residents in long-term care facilities, people 50 to 64 years old with underlying medical conditions, and people 18 to 49 who are at high risk of severe COVID-19 due to underlying medical conditions. As far as booster shots of Moderna and Johnson & Johnson COVID-19 vaccines, both have submitted requests for emergency use authorization to the FDA recently, and a decision is expected in the next month or so. Here at the City of Vancouver, we're still not mandating vaccinations for employees, but we are actively encouraging all employees to get vaccinated. We're also taking steps to ensure that our non-essential city facilities remain staffed at only 10 to 15%, with the majority of employees continuing to work from home through at least January of 2022. While no new in-person city service openings or increases in hours are planned at this time, you can find the latest in-person service hours schedule for each department, including online, phone, and virtual options on our city's website. The city's leadership continues to regularly assess local case data and follow the recommendations of state and local public health officials to determine any additional safety measures or requirements necessary to slow the spread of the virus. We remain committed to keeping our community and employees healthy, while also ensuring that the 24/7 services our community relies on never stops. Next, I'd like to also remind our community to follow the guidance of public health and please get tested if you've been in close contact with someone who has tested positive for the virus or if you're exhibiting any symptoms of COVID-19. A close contact is anyone who is within 6 feet of an infected person for a total of 15 minutes or more. You can find a full list of local test site options on Clark County Public Health's website. Now, it's mid-October and many of Vancouver's students have been back in the classroom for more than a month for the first time since the pandemic began. To help protect our children, the state has mandated vaccinations for all employees working in the kindergarten through 12th grade, most childcare and early learning, along with higher education, K-12 educators, school staff, coaches, bus drivers, school volunteers, and others working in school facilities now have until October 18th to be fully vaccinated as a condition of employment. Parents of Vancouver Public Schools and Evergreen Public Schools can find more information on their school policies, the state and local school guidance during the pandemic at the links on the screen. Finally, I want to acknowledge the emotional toll that the pandemic can take on all of us. If you're experiencing stress related to the pandemic, you can reach out to Washington Listens at 833-681-0211. This is free and it's an anonymous support line. It's open to any Washingtonian resident with support in several different languages. We can all do our part by showing patience, kindness, and understanding to one another right now. Please be compassionate. Stay connected. Be thoughtful and keep an eye out for your friends and family members who may need help and encourage them to get it. Please also remember that getting vaccinated, wearing a face mask, staying home, and physical distancing is not just about protecting yourself. It is an act of compassion and concern for the lives of others. Working together, we will get to the other side of this pandemic. Thank you for joining me for today's update. Stay healthy.